really to commemorate Zero Discrimination Day, which took place last Saturday. But today we're really honoring it and going to share some lived experiences around discrimination and really also share some resources that we've put together from the Hepatitis B Foundation. My name's Catherine Freeland. I'm the Associate Director of Public Health Research at the Hepatitis B Foundation. And once again, welcome. We're very happy to have all of you here today. Just a bit of the agenda for today. As you're joining, please feel free to introduce yourself, tell us who you are and where you're calling in from today, and you're all most welcome to join us. I'll be covering a bit of housekeeping as well as a community poll in just a few minutes. We'll be starting out the discussion really defining stigma and discrimination and why we're here and having this conversation today. We'll also be sharing the lived experience. So we'll hear from people who've actually experienced discrimination and they're part of our Hepatitis B Foundation storytelling program. So we're very thrilled to have them really launch the start of this webinar today. The Hepatitis B Foundation has also been working on resources to combat discrimination in your communities. We'll be starting with discussing the discrimination registry and country documentation. My colleague Anusha Khwareji will be presenting that. And we'll follow this by policy resources from Michaela Jackson and a specific country and state profile example from pharmacist Prince Okenedo, who will share some recent progress on anti-discrimination efforts in Delta State, Nigeria. Then we'll follow this with any question and answers and conclude today's session. Just for a bit of housekeeping for you all and your participation, since this is a Zoom webinar, you all are in listen-only mode and on mute. You can participate in the webinar today by using the chat feature, which I see many of you are already actively participating, and you're most welcome to continue to do so. If you experience any technical issues as well during the session, you can report them in the chat box. You can also use the question feature in the Zoom profile and ask any questions directly to panelists and speakers using the question box. Just a note that this session is also being recorded, and anyone who registered will be shared the recording of the session, and this will also be posted on our YouTube page from the Hepatitis B Foundation and can be viewed later. So I'd like to start today by learning a little bit about you as a participant and learn about where you're calling in from. So I'm going to launch our community poll. And if you could just insert in the community poll where you're calling in from today. Great, welcome everyone. I see we have folks from Pennsylvania, from Cameroon, from Sierra Leone, the UK, Ghana, Nigeria, a couple of folks from Nigeria, Kenya. We have some folks in the DC, Maryland and Virginia area, Ethiopia, Nepal, and North Carolina. Thanks so much for participating in the webinar. And we really are thrilled to have all of you here from really all over the world today. So thanks again for joining. I want to start by sharing a little bit about the Hepatitis B Foundation. We are a nonprofit organization that's dedicated to finding a cure and improving the quality of life for those affected by hepatitis B worldwide. This commitment includes funding focused research, promoting disease awareness, supporting immunization and treatment initiatives, and serving as a primary source of information for patients and their families, the medical and scientific community, and the general public. The focus of our webinar today is really thinking about the quality of life and the impact that hepatitis B has on the lives of people that are directly affected. Throughout the webinar, you'll hear from people with lived experience who have participated in our storytelling programs. And we encourage you to also share their stories and other stories that are on our storytelling website widely, so we can continue to dismantle discrimination and also raise the profile and awareness of hepatitis B worldwide. You can use the QR code linked on this slide to go directly to our website, which has a plethora of resources that you can use in your communities to address and raise awareness of hepatitis B. So we want to talk about why we're here today. Again, Saturday, March 1st was Zero Discrimination Day. So we're honoring and recognizing the impact of discrimination and stigma for people with hepatitis B around the world. We are very familiar with the negative impact that stigma and discrimination has on the lives and livelihoods of people living with hepatitis B. And my colleagues will go into some of the work that we've done to really document this impact. And we want to call attention to this significant issue so we can bring about advocacy and change, and we can empower you as our colleagues in this fight against discrimination and working towards hepatitis B elimination to really think about how we can work together to improve advocacy and awareness and create policy that really works to address this discrimination that's experienced by so many people around the world. So let's define what we're talking about first. So initially, stigma is something that is a social process that's characterized by the exclusion, rejection, blame, and devaluation of a person due to misconceptions and cultural beliefs about hepatitis B. This is something that happens for many people with hepatitis B, both internal stigma and external stigma, and being treated differently because of their hepatitis B status, or perceived to be treated differently because of their hepatitis B status. If we look at discrimination and how we define that for this webinar today, discrimination is defined as unjust, unfair, and prejudicial treatment of a person on the grounds of their hepatitis B status. So really, this discrimination, this stigma, is exactly what we're going to be talking about today. So I'd like to open it up to Shaibu. I know he's on the line here. To first share a bit about your experiences, your lived experience, and the impact that discrimination has had on you and lives of those living with hepatitis B. So welcome, Shaibu. We're really happy to have you here to share your experiences.
Yeah, hello.
Hi, Shaibu, we can hear you.
Okay, thank you very much. So first of all, I'm so excited to be in this webinar and to narrate my story about viral hepatitis B as a lived experience and global hepatitis advocate. My name is Shaibu Issa. I am global hepatitis advocate and lived experience from Tanzania. So my story as a hepatitis B patient started in 2017 in high school, where my brother felt stomachache for a while, and then he decided to go for the checkup. So the result showed that he's affected with viral hepatitis. So after coming back, he advised me to do the same. So he told me that Shaibu, you need to get tested for this disease. And I accepted it and I went. So the result also showed that I have positive hepatitis B surface antigen in my blood. And from that point, it where stigma, discrimination, and the social isolation we started to face, especially from the people who knew that we are affected with the virus. So discrimination was from our fellow students, from teachers, and everyone who knew that we have that situation. But so bad discrimination went far to the doctors and nurses who supposed to take care for our condition. I remember for the first time, doctor came at the school and announced to the all students that your fellow student are affected with this virus, so this is very dangerous. Actually, get distance from them because you might be affected. So it was negative call to action, like to insist our fellow student to isolate, to discriminate us. The first time we admitted at hospital, we witnessed something the same. I mean, most of the doctor and nurse, they refused to touch our body for fear that we will transmit the disease from them. So we stay for a while, and the bad enough, we kept into very small darkened room, and they suspect that we had HIV. So they falsely test us HIV for thinking that to have hepatitis, to have HIV. Actually, it was negative. So after that, we back to the school, and situation was the same to our fellow student. They negligent us. They not they are not likely to interact with us anymore. I mean, from school social activity, and even in class hours, most of them they get distance because they already told you that these people have had this disease. So when you get closer with them, you might be affected. So this was very bad to our mindset because at that time I knew nothing about viral hepatitis and my brothers too. So it's like very bad situation. Nobody like us. We It was totally challenge. After that, we got a referral to Muhimbili National Hospital, and this came after my brother first testing. I mean, ultrasound he showed that he had a very small pot into a liver that's indicated cirrhotic liver. So we went at Muhimbili, although it was very challenging, as you know, in Africa uh, our community, our family is very poor. So to accommodate, to go from a southern party of Tanzania to Dar es Salaam, it was very challenging. So I started to fundraising to the people so that they can support us to go at Muhimbili. At this time, it was like 1 month to come to our last examination. So it was a very challenging because we never been able to go to class again. We never been able to study because our psychologically were very distracted. So I fundraising and we got a small amount of money and we went to Dar es Salaam at Muhimbili National Hospital. In Dar es Salaam, also, the challenge was the same. Most of the people, they have negative perception about viral hepatitis. So we've been isolated. Isolation plus the cost of treatment because cost of treatment was very high. So compared it to our situation, plus the fundraising, so our family supposed to sold a few assets they produced at their young age. I mean, land and some of livestock to accommodate for the cost of treatment at Muhimbili. Although also it was very challenging because hepatitis treatment and medication it's very costly here in Tanzania and I think in Africa. So we live in that situation when we think about school, we think about our situation challenge. So after time, we go back to school to finalize our exam, and I can say everyone at that time believed that we could fail because we had no time to study anymore. We were very stressful. Everybody isolated from us. We never attended a group discussion because even our member refused to discuss with us for just fearing that if we get close to them or touching their body, will transmit the diseases. But God is great. We passed in our examination, and we got a chance to be enrolled at university. So we went also university together at University of Dodoma, and I took sociology, and my brother took environmental science. But the challenge became the same to access clinic, hepatology clinic at Muimbili. It was very challenging because our parent at that time had nothing, and ourselves we had nothing. So to travel from Dodoma to Dar es Salaam every time it was very challenging. And I remember at that time my brother cirrhotic liver was on progression. So it was very bad, and we given some medication, but we miss intensive care due to the situation of my brother. So it's like 3 years of university. It's make us to miss a lot of clinic at Muhimbili. After 3 years of university plus stigma and discrimination at school for those who knew our situation, although we try to manage and to be resilient with the conditioning, but it was very hard. After after graduating in 2020, end of 2020, my brother faced clinical conditioning. At that time, it was the liver cancer. Actually, he admitted at Muhimbili, but the challenge it came again how to handle the cost of treatment as parent had nursing. So I try harder to write the letter to the ministers, to the leaders, but their response it was like nothing. Nobody response, nobody care. So it reached a time that we had nothing to do. We're just waiting for the what happened for the God plan. So I think it was February 2021. My brother died at Muhimbili for hepatocellular carcinoma. After that, I was very desperate. I admit it, I was very desperate, hopeless, and I never believed that I could be here with you today because in my home and everyone who knew a situation plus days of my brother, it was like you were the next, you were the next, you were the next. So after that, I feel like what what if it's not me with my brother? What if a lot of people suffer with this? But for all of these 5 years, I never heard anyone about viral hepatitis. I mean, from doctor or anyone, but I hear information about malaria, HIV, and other communicable disease. Why not hepatitis? So it's disease with no attention. So that's where I started to go in social media to find its information in Google. And that's where I met with the Hepatitis B Foundation, and I applied to be in a global community advisory board. To be in HBV, this community advisory board, it was a great chance for me to learn. First, to learn about hepatitis, because what I hear for all the time, it was false information. Nobody spoke the reality about this. So I learned about this, and that's where I decided to be a global hepatitis advocate. So to fill the gap of silence that exists in hepatitis and tell the people the reality to stop discriminating patients because we are not guilty for this situation. 80% of uninfected people are infected from their mother. So I started to raise awareness, especially in social media, and to try to go physical to impact awareness. Because of time, I can say in discrimination, I face a lot. First of all, is mental health struggle. As I told you, everyone told me that you are the next, you die soon. So it was very bad to my psychology, but also to be discriminated in school. As I told you, in a workplace, till now I'm not hired anywhere. I'm just doing my issue, and especially advocacy. Why? Because the stigma and the discrimination affect me until now. Family and social isolation. Uh, one one leader from Ministry of Education called my family and told my mama that you needed to isolate Shaibu because we transmit the virus to the younger brothers and sisters. So you may imagine something like that. Someone from external try to make isolation into your family. It was very challenging. We have barrier of management disease, but also parenthood. I talked to Mary. Mary divorced with his husband due to viral hepatitis. So now she's responsible for the parenting herself without the husband. But the reason behind is viral hepatitis, increase of disease progression. Many people are afraid to go for the test and management. This gives chance for the virus to progress, especially to those who are not confirmed that their situation like untransmittable. But also, last is deny of healthy taking behavior. People are not more likely to go for the test. People are not prioritizing viral hepatitis because people are afraid. What if I am a positive for this? Uh, how my society will. So this is challenge why viral hepatitis is increasingly rapidly in Africa, despite the small effort that the government is trying to make. Although the effort is very small compared to the bigger of the program that we have. So without wasting more time, let me thank you. I will continue to answer the question. Thank you, Catherine.
Thank you so much, Shaibu. Thank you for your bravery and sharing your story. I think, and also sorry to hear again about your brother. And I think though that you're really honoring him in the work that you're doing. I don't know. I hope that others are aware of your impressive advocacy activities that you do on social media, really working to address the stigma and the discrimination that you've experienced by spreading accurate information widely. I think you've done a really wonderful job raising that awareness, and more work like that is really needed. So really want to appreciate you both for sharing and also for the work that you do on the ground in Tanzania and then more widely, because you really have a global impact, which is very impressive. And we really appreciate you leading that effort. I wonder if you can share and maybe give some advice to people that have been diagnosed with hepatitis B, if you have, to say how you were able to maybe overcome some of the challenges with stigma and discrimination that you've experienced.
Yeah, okay. To all people lived with chronic hepatitis globally, first, stop feeling that you are guilty for the disease. And, you know, stigma and discrimination create fear, sense of fear. So, how to address fear? To address fear is to face what you fear. As what I'm doing that for those who discriminate or spoke negative information about viral hepatitis, I face them and educate them so that they can, we say to humanize disease. When we humanize disease, and as now HIV is not something very threaty as 99, we needed to put hepatitis into that profile. So, but also believe that to have viral hepatitis is not to die, actually, and that's why I'm here today with you. Although I have more than 7 years since my diagnosis, but only if you abide what you are told with your doctor. For instance, if you're living with chronic hepatitis and you consume alcohol, stop it. Stop it because it will make it difficulty for your treatment team, and also, if you take a cigarette, stop it. If you very likely to certain kind of food like junk food, stop it. If you are impressed with a certain kind of local medication which which we are not sure with its purity and safety, also stop it, because sometimes you can have a hepatitis, but it can be self-healed. You can heal it itself, but when you take a medication which you are not advised to take it, you may make a situation to be more bad than it's before. But also believe yourself. To be with chronic hepatitis does not isolate you from other people. We are human beings, we have ability, we have skills. So to address this challenge, first you have to accept it and to talk to those who make challenge on this, to take it as a little thing. For me here in Tanzania, I transform mindset a lot of people and globally, because I've been raised awareness for more than 4 years. And Catherine was the first one to tell me that, Shaibu, you can do this. At that time, I was not being able even to express my name, like my name is Shaibu Issa, I'm from Tanzania. Catherine know that. But now I'm a global speaker. Now I'm a global advocate. Why? Because I believe and I accept that I have this situation and I can't remove it for myself. But God can do it, can do with my effort. So for now, I have no worry, even if I feel a little stomach pain. But the challenge that we have is that the people with viral hepatitis, when he or she feel any pain in his stomach, he feels that this is liver cancer, which is actually not. To have hepatitis is not an exception of seeking of feeling other medical condition. You will suffer malaria, stomach, and many other diseases you will suffer. But the hepatitis is there. So this first reduce your immune system, because if you are very depressed all the time, I meet a lot of people. You meet someone very thin, but because you feel like I'm going to die, doctor told me that this is very bad disease. I'm told this is my street. So this stigma, this negative perception is draw negative attention to the disease, and the disease increase because we fail to control. So we need to control. And how to control? We need to control it from our mindset. How we take it is the first medicine to challenge the disease. But if you thinking that positive that you die, you might die, because when disease progress rapidly, it will be very easy to develop liver cancer and cirrhosis. But when you challenge it, you believe you're okay, you raise awareness, it's very easy for your immunity. I can tell you that for the first time I going for diagnosis, it was 53 million viral load. After being with foundation, learning, my psychology was stable. I went again. I faced it was 29 million viral load from no 21,000, 29,000 from 53 million viral load. So you might see the power of releasing fear, the power of releasing what make your immunity to go down. But also, the most important thing is talk to your community, because if you are not safe, don't like other people to be in threat. Talk to other people also so that they can get tested and be vaccinated. Because the best advantage we have in this disease is that we have vaccine over 40 years now. Vaccine that can save people from being infected, but also the first ever vaccine that can prevent someone from liver cancer. But the problem that we have in Africa and even in so many places is awareness. So people can't ask vaccine for the disease they don't know, can't ask testing for the disease they are not informed. So you need to inform other people so that they can know. If they know, they will take action. We needed to find what you call a missing million. We have 100. We have no 350 million people who are living with chronic hepatitis globally. But it might be we have more people who are not diagnosed. So this we call missing million. But we can't find them if we are still silent and we treat it silently. It will be very difficult. Thank you, Catherine.
Thank you so much, Shaibu. I think your message is very clear. The need for testing to know people's status is really critical. Finding the missing millions, as you mentioned. I think also you mentioned once someone knows that they're infected, making sure that they're maintaining their own health is really important. And that being, avoiding alcohol, avoiding tobacco, living a healthy lifestyle is really critical, and taking care of their own health first is really key. And the biggest message is hepatitis B is not a death sentence, especially if someone is diagnosed early. There's action that can be done to prevent liver damage and liver cancer from happening as it happened in your brother's situation. So really, again, appreciate you sharing your story. And my colleague Michelle posted your YouTube story, which was created in partnership with the foundation, created by Shaibu. Uh, and it's available on our YouTube page there. Michelle put Shaibu's story in the chat, as well as our other colleague MF, who was not able to be with us today, unfortunately. But I hope that you'll be able to view those stories and others within our storytelling program. So thank you again, Shaibu. I'm sure maybe there will be some questions that come up as we get into the next phase of our presentation, but really appreciate you for being here and for your bravery and the great work that you're doing on the ground and also globally. So really, really want to appreciate you. All right, so now I'd like to move into the resources that we've worked on over the past several months from the Hepatitis B Foundation side to help support uh, combating stigma and discrimination in your own community. So at this time, I'd like to hand it over to my colleague Anusha, who will be reviewing the resources that really she has helped to lead the effort on. So I'll hand it over to you, Anusha.
Hi, everyone. I'm Anusha Qureshi. I'm one of the public health program coordinators here at the foundation, and I will be speaking a little bit more about discrimination and specifically our Hep B Foundation's discrimination registry. So I'm just going to share my screen. Catherine, let me know if you can see it yet.
Yes, it's coming through. Yep.
Okay, sounds good. I'm just going to put it in slideshow. Okay, so this is really just a preview of a toolkit that we are working on that will be available later this month on our foundation's website about how to address hepatitis B discrimination and some of the survey results from our discrimination registry. So the Hepatitis B Discrimination Registry was first launched in 2021 with the goal to document and track discrimination related to hepatitis B around the world. We focus on the lived experience of people around the globe and its economic, social, and mental impact. To date, we have received over 600 responses, over 640 responses from over 70 different countries. And I'm going to be going more into detail about the survey results, but before we get to that, I want to just generally talk about some of the impact of discrimination. So this registry has been very critical in helping us understand the true impact of discrimination since it's hardly ever documented or tracked. And we know that the relationship between stigma and discrimination is interconnected. And Catherine kind of spoke about that, as did the storytellers earlier today. So for many people, discrimination has a negative psychological impact as it leads to social isolation, depression, and anxiety about sharing their status or possibly risking transmitting the virus to their loved ones if they don't share their status. We know that discrimination can block people from accessing certain educational and economic opportunities. People can be refused admission into schools, can be terminated from work, demoted from work, or simply refused to be hired for work opportunities because of their status. In a lot of countries, it is mandated and required that they go through a health screening process before they can get hired. And since this can often bar entry and into certain workspaces, but then also um, have economic setbacks, this is a real issue for a lot of people, and not just in countries. Sometimes a lot of people are applying for work visas in different countries. So they might be experiencing discrimination in their home country, but if they try to get work outside of their country, they might also be experiencing discrimination during the immigration and work visa process. Usually because those other countries also have some kind of discriminatory policies, or lack of legal protections. So these are some of the results from our most recent analysis of the registry. As I mentioned, we had over 640 participants and over 70 countries represented. We found that over 86% of the people who filled out our survey reported that they were discriminated due to their hepatitis B status. And of those who did report discrimination, 60% were men, 40% were female. And the age range of these participants also varied. As you can see, most of them were between the age range of 18 to 39 years of age. And we also had some elder adults as well. And then we found that we got a lot of discrimination incidents from the Philippines, from Nigeria, from India, Pakistan, Uganda, Ghana, Ethiopia, UAE, and the United States as well. And we found that there were very different kinds of discrimination that was happening here. So there was social media discrimination. This is online. It's more like cyberbullying, but it's also just leaving negative comments, and it also creates a culture of social isolation, depression, and anxiety for a lot of people who seek social media to connect with others in public places. This could be discrimination that has to do with, for example, not being able to go to a park, being denied entry into certain public spaces because of your hepatitis B status. Health facilities also tend to discriminate in some countries. There's a lot of discrimination that's reported in their private residence and their home environments and educational settings and places of worship, as well as immigration-related discrimination. This usually happens if people are applying for work visas, travel visas, or educational visas abroad. So now we're going to go a little bit into the country profiles. We selected some of the top countries that were represented in our discrimination registry analysis. So first is Nigeria. As you can see, Nigeria has a high prevalence of hepatitis B. Sorry about that. Nigeria has a high prevalence of hepatitis B with over 20 million people infected. Many are also undiagnosed. In Nigeria, there is a discrimination policy against persons with disability act of, with the Discrimination Against Persons with Disability Act of 2018 and the HIV and AIDS Act of 2014, which prohibits discrimination against people living with HIV and other disabilities. However, many Nigerians, as was evident in our registry, they have reported experiencing discrimination and stigma in workplaces and in other settings. So to focus a little bit more on Nigeria, we found that a lot of people experience discrimination in the health facilities and in educational settings, as well as immigration-related settings. I do want to point out that although discrimination is happening and there are written laws that provide protections against discrimination, there have been advocacy efforts and some regional initiatives that have been aimed to address this issue. So for example, in Delta State, there have been steps to include hepatitis B and C within the existing HIV and AIDS anti-discrimination prevention and protection law. This is a steady step, but a positive step towards reducing discrimination and hopefully also improving care for those affected by hepatitis B. In Uganda, this was another country with a high prevalence of hepatitis B. Again, there is no policy that focuses on discrimination, but there have been an uptake in the programs and activities that have been used to reduce the burden of hepatitis B, such as upscaling vaccine and screening programs. This still does help with discrimination when you upscale screening and vaccination programs, as it helps people feel less isolated and alone, and kind of removes the shame aspect when testing and access to vaccination is universal, more people can get it. But there needs to be more that needs to be done to reduce discrimination in the employment, education, and healthcare sector. As you can see, immigration-related discrimination was the most common kind of discrimination, followed by educational settings, health facilities, private home residence, home environments, place of worship, and then in public spaces. In Ethiopia, again, there is no strategic plan, no policy included in the strategic plan that focuses on discrimination. Discrimination against individuals with hepatitis B is common and tends to happen a lot more in the immigration, education, and home space than it does in other kinds of discrimination. In the Philippines, this was out of all of the countries that we had represented in our registry, we got most responses from the Philippines. The Philippines also has a high prevalence of Hep B, with over 8% of their population living with hepatitis B. Now, the Department of Labor and Employment in the Philippines has implemented protections against hepatitis B in the workplace specifically, which means that employees cannot be dismissed, demoted, or transferred just because of their positive status. It does not extend to other contexts, which is desperately needed, such as immigration-related, health facilities, educational, and other kinds of discrimination. Pakistan also has a high prevalence of hepatitis B, with over 12,000 deaths attributed to HBV. And although there is a national strategy, it needs to be updated with current guidelines and best practices. It also does not have any policy or written laws against discrimination. And it looks like immigration related is the most common kind of discrimination that occurs in Pakistan, followed by health facilities and educational settings. In Ghana, there's about 9% of the population is living with hepatitis B. And while there is a comprehensive policy framework that includes initiatives to address hepatitis B, as there are in some other countries, such as upscaling screening and vaccination programs, there is again no protection, no legal written law that protects people from being discriminated against in Ghana because of their hepatitis B status. Again, immigration-related, health facility, and educational settings are some of the most common and top types of discrimination that occurred in this country. India also does not have a specific policy or law that tackles discrimination related to Hep B or offers protections. Again, immigration-related, with over 43%, they had an immigration-related discrimination, followed by home environments, health facilities, and educational settings. In the United States, there are laws against that protect people from being discriminated against due to the Americans with Disabilities Act and the Civil Rights Act. However, in the United States, they are not allowed to serve in the military. So a very specific kind of military discrimination, which was not talked about in our analysis here because it was not included in this analysis. It is a very common kind of type of discrimination that occurs not just in the United States, but also globally. So that is something that is missing here, and we don't have accurate data on just how many countries or how many people are being affected with military-related discrimination, but it certainly is very common. I do want to say in the United States, even though there are protections and laws against discriminating people with Hep B, we have noticed even here at the foundation, there have been cases that have brought up to us where people were barred admission to a medical school program in the US because of their Hep B status, or a nursing school program because of their Hep B status. It can happen, however, having those legal protections and those laws that can be implemented is really helpful in kind of overturning those incidents. As seen here, in the US, the most common kind of discrimination is health facilities, home, public spaces, and educational settings, along with online settings. So how can we address discrimination? It is clear that we need policy change, and Michaela will be talking a little bit more about this, but this basically means that we need to implement and enforce anti-discrimination laws that specifically protect individuals with hepatitis B. This includes workplace protections, healthcare rights, and educational access. And we need to work towards stigma reduction interventions too. And this includes increasing awareness about hepatitis B transmission, prevention, and treatment to reduce the stigma and reduce incidents of discrimination. This includes launching educational campaigns that can help dispel myths and misconceptions about hepatitis B, amplifying the voices of people living with hepatitis B through our storytelling programs and initiatives is an excellent and effective strategy to help people learn more about Hep B, how it's transmitted, and that it can be treated and it's not a death sentence. Additionally, we need to implement training programs to offer non-discriminatory and compassionate care to individuals with hepatitis B. This is not just restricted to employers, but can be applied in different settings like healthcare professionals, educators, immigration officials, and this can help promote a culture of inclusivity and improve awareness about hepatitis B. Focus group sessions are also a great way to learn more about attitudes related to Hep B and liver cancer, so efforts can be made to address any misconceptions with future programming. And most importantly, addressing discrimination will require global collaboration from countries, from WHO, from the World Hep Alliance, the Hep B Foundation, and all other different stakeholders, as we still need to track and document discrimination, develop effective interventions, and initiate legal protections for people living with hepatitis B that are not just written in law, but are also enforceable to improve the health outcomes of all people living with hepatitis B. And then to end with, these are some of the recent publications specific to hepatitis B discrimination. The first one, Global Responses Requiring Global Data, delves a little bit deeper into the registry analysis, as well as the survey of lived experience and challenges in hepatitis B management and treatment, and the urgent need to end hepatitis B stigma and discrimination is a call to action for all partners and stakeholders. And that is it.
Great. Thanks so much, Anusha. Really appreciate your presentation. For those that may have any questions for Anusha, please feel free to put them in the chat. But in the interest of time, I'm going to pass it over to my colleague, Michaela, to speak about policy resources. Michaela, over to you.
Thanks, Catherine. So I will just be very brief. So hi, everyone. My name is Michaela Jackson. I am the Program Director of Prevention Policy at the Hepatitis B Foundation, and I'll be talking about a document that complements Anusha's work. So essentially, this policy toolkit is really an international guide that offers a global perspective of discrimination. We don't focus on only one country. We focus on basically all of them. And it's really a testament to the lived experience of people living with hepatitis B. We're highlighting the numerous struggles and impacts of discrimination through quotes, through research, and it's primarily to serve as a resource with tools for countries to combat the discrimination that Anusha touched on in her presentation. So I just wanted to highlight one of the resources that we have in there, which tells the stories of what's actually going on in some of the countries. So the most reported forms of discrimination took place through the employer immigration, or through health facilities. You can see 2 quotes on the screen that are from people who live in Dubai and from the Philippines, and both of these are examples of workplace discrimination. And when the workplace found out they had hepatitis B, what they experienced and what they had to go through. And unfortunately, these stories are all too common, which makes our work here today incredibly important. So the document really covers a broad range of things to help be the best resource possible. We talk about what stigma is versus discrimination, as I think sometimes the 2 ideas can get very conflated. We talk about policy recommendations for best practices for anti-discrimination. We include model countries for policy. This includes the United States, where we talk about policies that prevent discrimination in public spaces, healthcare spaces, and students in medical school. We also highlight Australia. They have a lot of resources and policies around a right to a person's privacy, the right to disclose, and when providers should not disclose without a person's consent, and also protection around healthcare workers. I will note, as Anusha did, but obviously the United States and Australia, they're not perfect countries. Discrimination still happens in these countries as well, right? But because these policies are on the books, it makes it a lot easier to go ahead and take action against discrimination, whereas a country who might not have any protections, there might not be a lot that a person can do in those circumstances. We also provide example legislation, so specific language around protections for people with hepatitis B and hepatitis C. This is really exciting because it includes language that you can just insert your country in a couple of pieces of information and then take this to your legislatures and work with them to create strong anti-discrimination policies. And we also include a plethora of resources at the end, which include the discrimination registry, the discrimination guide Anusha touched on, and links to our Be the Voice program, because telling these stories is incredibly important to documenting what's going on and then going ahead and making change. And lastly, I just wanted to show an example of what the policy discrimination language looks like. So you can see in blue that there's places where you are meant to go ahead and input what you are working on specifically and just alter the language a little bit. But you can see it's very comprehensive, covers a lot, and is really focused on anti-discrimination for people living with viral hepatitis across the board. And with that, I will go ahead and turn it over to Prince. Thank you.
Thanks, Michaela. So at this time, we're going to hand it over to Prince, who's going to speak about the work that he's doing in Delta State and how you can apply what he's doing on the ground in your settings. Prince, over to you.
Yeah, hi, Catherine.
Hi, Prince. We can hear you.
Yeah, thank you very much. Sorry, I was trying to unmute.
No problem.
So, thank you very much. Good evening, everyone. It's evening. It's about 4:56 p.m. here in Nigeria, Delta State. And so, first, let me thank you. Very inspiring. Listening to your story, it always inspires me. And again, reminds us of why we need to do, why we need to put more efforts, in this viral hepatitis, fight. Thank you very much, Shaibu, and all the panelists here. So I don't know, is it possible to share my screen, Catherine?
Yes, feel free. Sorry, I didn't know that you wanted to do that. Feel free.
Oh, I just have like 3 slides.
Go ahead. Yeah, you're welcome.
Okay. So can you see my screen now?
Yes. Yeah, perfect.
Great, that's fine. So, we've been, I will just be sharing some insights from advocacy work that we've been doing on the ground in Delta States, in collaboration with the Hepatitis B Foundation. And, we've been quite busy, and a couple of things, but just to restrict or limit this talk to areas relating to advocacy and discrimination, stigma and discrimination against persons living with hepatitis B. So I think some 2023, November 2023, precisely, Catherine, my colleagues and folks from the Ministry of Health, we did an advocacy call to the First Lady of Delta State, Her Excellency Dikines Tobore Oborori. One of the things we brought to her notice was the issue of discrimination and stigmatization against persons living with hepatitis B and C. And so, prior to that time, there was not much said about hepatitis B, and even let's talk less of bringing the issue of stigma and discrimination. So, but it was one of the requests we made to the First Lady, amongst other requests. Although one of the requests again, which was to include screening of all pregnant positive women, because the Delta State government runs a health insurance, which hepatitis B is not covered, was not covered at the time. So screening was not covered and was not done. And sometimes when they were done out of pocket for the pregnant women. And so graciously, she discussed with the governor on that, and I can happily say that at the moment, Delta State is one of the states that runs a health insurance that covers the free screening for all pregnant positive women, or rather, free screening for all pregnant women receiving antenatal care services under the health insurance. So this is paid for by the government. Okay, so this is one of the things advocacy can do, bringing these kind of issues to those who can move the needle. So as part of that, also one of the things, as I said, it was the issue of stigma and discrimination. And I learned that the First Lady was interested in this issue, okay, and then she had some discussions with some members of parliament on this. Meanwhile, the Delta State currently has an HIV and AIDS antidote, which was enacted in 2022. So one of the things we were asked law, which was to call for a review for that law, or to enact an entirely new law to cover for hepatitis B and C. But whichever way the parliamentarians want to do that, that will be fine, as long as hepatitis B and C, is covered. The discrimination and stigmatization is covered. So very recently, again, we were at the parliament. That was last month. Catherine was around, so we took the advocacy to the Delta State House of Assembly, where we engaged with the majority leader of the House. So in hierarchy, in the state's legislature, you have the speaker, you have the deputy speaker, then the majority leader, which is the third in ranking. And so we had this engagement. Meanwhile, the majority leader is the husband to one of my senior colleagues. And so I was able to explore that relationship to have this courtesy call. And we're very happy to see, to be received by the majority leader. We briefed him on the need for the state to have a policy and to have a law protecting persons living with hepatitis B and C. Just this morning, I had somebody sent from one organization, because what we are seeing at the moment now is, we are intensifying efforts to increase the knowledge of hepatitis C among the general public. But again, while many persons are beginning to learn about hepatitis B and hepatitis C, we are also seeing increased level of stigmatization and discrimination alongside. So today, as I said, somebody was sent from one of the facilities, and she tested positive for hepatitis B, and the company is refusing to hire that lady. So there's hardly a week that will pass without having people, coming this way, running into this kind of situation. So it speaks to the need for us to have a law that can protect people living with hepatitis B. And again, the law we're looking at is really, we're not interested in punishing people who stigmatize or discriminate against persons living with hepatitis B or C. Rather, it's just a backing just to protect the people. We are more interested in educating people on viral hepatitis. Let them understand that people who are living with viral hepatitis B or C pose no risk to others. They should not be seen as biohazards walking around. So I would just share a little of my experience I had with one very top government official sometime in 2023, where this event was to hold in Government House. And so she called me that morning and said, "Prince, please, when you are coming, ensure to put on a long sleeves." And so I was curious as to why she wanted me to put on a long sleeves. I asked, "May I know why, ma?" And so that because I didn't want to ask her directly because she's a very top person in government, and I didn't want to offend her again. So I asked, "May I know why?" And then maybe the color of the long sleeve, perhaps that's the dress code, so I don't, dress odd. So she said, "No, that's not the dress code. Because you have hepatitis B and you'll be making some contacts with people, just to protect others." So, okay. So I said, "Okay, I get it." And so I just greeted her. And what I was supposed to talk about that day, I was to give a talk. What I was supposed to talk about, I changed the topic. My focus was stigma and discrimination. And so I saw it I didn't feel offended. I saw it as an opportunity to educate people, and especially the caliber of people that would be in that function. And so when I got there, when I set out, I wore a pair of long sleeves just to allow them admit me. And after my talk, she walked up to me and she shook my hand and told me, "Prince, I'm sorry, I didn't know that hepatitis B cannot be transmitted via sweat." That was what she was told. I said, "I understand." And that was why I had to change my topic to address this issue. She was happy that was done. So again, while we are advocating for policies, we're advocating for laws, to protect people who are living with viral hepatitis, people who are living with viral hepatitis can also use their own personal life experiences to push for this kind of laws. So I see it as a person living with viral hepatitis B, I see it as a call to duty to use my own personal experiences to push for the things I want to see happen in Delta State and in Nigeria, I should say globally. So that is the perception that we should be having. When Shaibu was talking about, people living with hepatitis B, how to react and all that, it's really not a death sentence. It is a call to duty. That's how I see it. People who are living with hepatitis B, we can really advocate for what we want. What do we really want? We don't want people to discriminate against us. Then we should come out and start talking about these things. So I don't see, I can say I really don't feel or experience discrimination. I don't see it as that. When you talk about hepatitis B, about me, I really don't see it as discrimination. I see it as, or you're trying to stigmatize me. I see it as an opportunity to educate one more person. So I always get excited when somebody talks about, in fact, jokingly, some would call me Prince Hepatitis and all those kind of things. Like one of my friends in Nigeria, when you do a lot of hepatitis work, people try to now associate that with you. And I'm glad that that's happening. Okay, so that's just one of the things we do with advocacy. So it was the following day, the majority leader, published this in his official Facebook media team. So that's what you are seeing on the right side. So he expressed willingness and commitment, to pushing this further. So we'll be engaging more with him in this regard, supplying him with the necessary materials that he will use. And he's even offered to raise this on the floor of the House for a debate and possible passage of this. But again, this engagement is just beginning, and we hope to continue with this engagement. And we also visited another parliamentarian in Delta State House of Assembly. So, what we are doing is like what the politicians will call lobbying. Yes, we need the more voices we get on this matter, the easier it becomes for, it will be for this kind of policy to sail through the House. Politicians like them to be carried along. So the majority leader is a key officer in the House, and when he raises a motion, people are likely to, to support this motion. So, but again, we don't want to take the chances. We really don't want to take that for granted. We want to also engage with other parliamentarians as much as we can, so that when this kind of issue is raised on the floor of the House, everybody is attuned and they can support. I would just like to stop here and say thank you very much for taking your time. I'll be glad to take any questions.
Thank you so much, Prince. Really appreciate you sharing this case example of how you were able to work towards anti-discrimination policy in Delta State. And I hope the message can come across to others that they can also do this themselves in their own jurisdictions as well. Taking steps to make relationships with your local representatives, your local government leaders, setting up meetings with them, educating them on hepatitis B is really critical. Like Prince mentioned, taking every opportunity that you have to really share accurate information with them about hepatitis B, and looking for opportunities, spaces that they're interested in. Prince mentioned the First Lady was interested in anti-discrimination policy, and how can we leverage that in other spaces with other officials is really important to think about how to use in your own community. So I think it just given the time that we're at now, I think we do have to conclude, but I hope that all of you will help continue these conversations around anti-discrimination efforts in your communities. You can always reach out to us if you do have questions, or if you want to have conversations with us about how to implement similar initiatives or how to go about doing that. If you have more questions, Additionally, in the for everyone who registered, as well as on our website, we'll be sharing soon the recording of today's webinar, as well as the links to resources Michaela and Anusha shared with you today. And hopefully, I think we'll be working on writing up the case example from Delta State so others can also apply that in practice as well. But really want to take a minute to appreciate all of our speakers and appreciate all of you as attendees for participating in the webinar today. We're really grateful to have you, and we hope that you will also be motivated to work on anti-discrimination efforts in your communities. Thank you all so much. And with this, I'd like to conclude today's session. Thanks, everyone. Thanks, Prince.
Yeah, thank you so much. I appreciate the time.
Thank you.